Welcome to the deep dive. Today, we're jumping into something really fascinating. It's called BioniChaos.
Right. It's this platform that brings together biomedical data, some really cutting-edge tech, and educational tools in a pretty unique way.
Yeah, exactly. And our mission for this deep dive is basically to unpack how BioniChaos takes these super complex medical and biological ideas.
Things that are usually pretty hard to grasp.
Totally. And turns them into experiences that are, understandable, interactive, and honestly, quite engaging.
Think of it as a shortcut, maybe.
Yeah.
A way for you to get informed about some really complex but important areas in health tech.
We're going to look at simulations where you can, peek inside the brain.
And dissect complex signals, navigate these massive medical data sets.
And even touch on some of the ethical questions that pop up.
Yeah, that's important too. Get ready for some aha moments, I think.
Okay, let's start with the brain. Visualizing the signals of thought. BioniChaos has this interactive brain EEG simulation.
Right. And this isn't just, a picture. It lets you actively visualize and explore EEG signal.
It goes deeper too, right, with analysis like PCA and ICA.
Exactly. PTA and ICA, for those who might not know, they're basically smart mathematical ways to find the real patterns and sort of filter out the noise and all that complex brain data.
Makes sense. So it brings brain activity to life for learning.
Precisely. For learning, for demos. And to help with that, there's also the interactive guide to EEG technologies.
Oh, okay. So this gets into the nuts and bolts.
Yeah. Everything from the electrodes, where you put them, how invasive different methods are.
And the different brain waves, delta, theta.
All of them. Delta for deep sleep, theta for relaxation, alpha, beta.
Yeah.
It visualizes how we see these different states of mind. It's key to interpreting those rhythms you see.
Okay, so we can see the signals, but then there's this next tool, the AI-powered EEG speech decoding report. Wow.
Yeah.
I mean, translating brain activity directly into speech, the possibilities just seem huge.
It's a massive leap, really. This report digs into the new approaches trying to make that happen, turning brain signals into actual words.
What's the big insight there, beyond just the tech itself?
Well, I think it's the jump from theory, BCI theory, to potentially practical communication.
Right.
Think about people with severe speech issues or emergency situations, maybe.
Yeah.
It's about giving a voice back, potentially. That's more than just tech. It's profound. A huge step in how humans and computers might interact.
Absolutely astonishing. And for people wanting to get even more hands-on.
There's the advanced EEG signal simulator. That's where you can customize the brain waves.
Simulate artifacts, too, those glitches that mess things up.
Yep. Simulate artifacts, see the signals in time and frequency. It's really geared towards researchers, BCI development, that kind of thing.
And building on that foundation.
There are specific tools like Rhythm Scan. This lets you explore real EEG data, visualize things called spectrograms, and understand how machine learning is used for, say, seizure detection.
Which actually leads us nicely into understanding complex signals more generally, not just brainwaves.
Right, because understanding any of these signals, it often comes down to finding the patterns underneath.
So we shift from biology to the math behind it, like Fourier analysis.
Exactly. And BioniChaos has a really captivating tool for this, the Fourier series visualization.
Oh, I think I saw this one. You draw a shape.
Any shape you want, yeah. And then you watch as the tool rebuilds it using a sum of rotating vectors, epicycles, basically.
It's kind of mesmerizing.
It is. And it shows beautifully how even incredibly complex, jagged patterns can be broken down into simple, smooth sine waves.
Which is fundamental to so much, right? Signal processing, sound, images.
Absolutely. It reveals this sort of hidden order in seemingly chaotic data.
I remember when I first tried to learn Fourier analysis, it felt, daunting, like math magic. Does BioniChaos help make it less intimidating?
I think so, yeah. That's the whole point of these interactive tools. They have a high-fidelity Fourier simulation, too. It gives you real-time visuals of the signal, the frequency parts, those spinning epicycles. It makes it intuitive, not just abstract equations.
So you can really see the math at work.
Precisely.
Okay, so we have these powerful ways to analyze signals. What about applying this to just the sheer volume of medical data that's out there now? How do we navigate that?
That's a huge challenge, and BioniChaos addresses it with tools like the Multimodal Medical Data Landscape, an interactive report.
Multimodal meaning? different types of data together.
Exactly. EEG, ECG, imaging, etc. This report looks at publicly available raw data sets, especially for cardiovascular applications.
And it helps you see where the gaps are.
Yeah, visualize the gaps, find ways to maybe connect different data sources, because just having data isn't enough. You need to make it work together.
And there's an Explorer tool for that too.
The Interactive Explorer. Public, multimodal biomedical data sets. It's a web app specifically designed to help you dig into these varied data sets. EEG, ECG, PPG, fNIRS.
So many acronyms. How do researchers even decide which data type is best for their question?
Good question. That's where the modality comparison bubble chart comes in handy.
A bubble chart.
Yeah, it visually compares different sensing methods based on things like how fast they can measure changes temporal resolution and how precisely they can pinpoint location spatial resolution.
Ah, okay. So it helps you choose the right tool for the job, whether you need speed or detail in space.
Exactly. It highlights those trade-offs, making disparate data work together. It's a big strategic piece.
Okay, let's shift gears a bit. Talk about specific applications, maybe starting with hearing. Cochlear implants.
Sure. BioniChaos has a Cochlear Limited, a visual analysis. This dives into the company, the tech, the history, finances.
But also the ethics.
Yes, importantly, it includes the ethical discussions and controversies around them. It doesn't shy away from that complexity. It lets you see different sides of the debate about their impact.
Which is crucial for a full picture.
Definitely. And then you can actually simulate how they work. With the Cochlear implant simulation, you can visualize the electrical signals going to the brain, tweak parameters, see how it changes the potential outcome.
Wow. And there's even a 3D simulator for the implant itself.
Yeah, the Cochlear implant ring electrode simulator. It uses 3D visuals to show the mechanics of inserting the implant. Really shows the precision needed.
Incredible detail. Okay, moving beyond hearing, other vital signals. The heart, for instance.
Right. There's an ECG simulator.
Yeah.
An interactive tool where you can explore different heart rhythms.
Not just normal versus abnormal.
No, you can see how changing different electrophysiological parameters actually affects the ECG waveform you see on the screen. It helps you understand the nuances.
And sometimes these systems are connected, right? Heart and brain.
Absolutely. There's an epilepsy and cardiac health interactive evidence review.
Ah, interesting link.
Yeah, it explores that complex relationship, how epilepsy and heart health interact, the effects of medications, different study methods, clinical guidelines. It's a really important intersection in patient care.
Understanding one helps manage the other.
Often, yes. And speaking of brain imaging, besides EEG, there's fNIRS.
fNIRS.
Functional near-infrared spectroscopy. It measures brain activity differently by looking at blood oxygen changes, less invasive than some methods.
And BioniChaos has a tool for that?
An fNIRS interactive viewer lets you visualize that time series data, select channels, navigate through events recorded during the scan, useful for certain kinds of neuroscience research.
Okay, fascinating. Lastly, let's touch on two different but key areas. One is the power of the mind itself, like with neurofeedback.
Right, the neurofeedback, placebo or panacea review tackles that head-on.
Placebo or panacea, so it addresses the debate.
Exactly. It looks at the evidence for using neurofeedback for things like ADHD, anxiety, depression. But critically, it compares both the supportive studies and the skeptical views from clinical trials.
So it encourages you to think critically about it.
Precisely. It's not just pushing one view. It highlights the need for really rigorous, balanced assessment of these emerging therapies.
That's really valuable. And the final piece, understanding noise.
Yeah, the stuff that gets in the way of the signal you want to see. The synthetic noise generator dashboard.
What does that do?
It lets you generate and visualize different kinds of noise. White noise, pink, brown, even periodic noise. You can tweak parameters and see how they look in time and frequency.
Why is that useful?
Because you can't really understand the signal or clean it up properly unless you understand the noise that's mixed in with it. It's crucial for interpreting real-world data accurately.
So this whole deep dive into BioniChaos, it really demonstrates how these interactive simulations and data tools can, well, demystify some seriously complex stuff.
Yeah, it makes biomedical information much more accessible and insightful, whether you're a student just starting out or, a seasoned researcher.
The combination of seeing, simulating, analyzing, it gives you a unique window into neuroscience, biomedical engineering, heart health.
It turns data into an experience, really. It's more hands-on.
So wrapping up, what does this all mean for you listening? I think it raises a really interesting question. As these kinds of interactive tools get better and easier to access, Could they fundamentally change how we understand our own biology?
How we engage with our own health data.
Exactly. Imagine being able to visualize and interpret aspects of your own health with this kind of clarity. The future of personalized medicine might look very different.
Definitely something to think about, how that interaction might evolve.
Food for thought as we keep exploring the cutting edge.